Thank you for that warm welcome. And I'm really delighted to be here and that all of you have joined us for this workshop. It's a shame that we can't meet in person. I really do miss in-person conferences and the interaction we can have there, but we do our best, and I think we have in the last few years with Zoom conferences. And I really welcome your participation and involvement. Workshops are so difficult when they're online to engage everybody. I've tried to incorporate, some discussion questions and some videos to make this, more engaging, but really your participation would be so welcome. So please, I know Aresh is monitoring the chat on the side. You're happy to, I'm pleased if you can unmute yourself and ask the questions directly as well, or put it in the chat. Do you want to make this, more interactive? And I know there are those here in the audience who are educators yourselves, who have a lot of experience with substance use prevention, school-based programs and universal programs, and maybe have struggled, had some barriers in implementing, seeing how certain things have worked. And it would be great if you could share your experience too. I think today I'm not so much, promoting any specific type of universal prevention models, certain ones over others, but really just talking about some evidence behind models that have worked, some prevention programs that have had some evidence behind it. And, that's the only way we can go by to understand whether something works or not, is to have research and have that evidence there. But oftentimes I think many programs are implemented without a research design behind it, unfortunately. And so there may not be the data to show, it's effective and that it works. But that's also areas that I think we could share a little bit more about, and perhaps talk about how to incorporate research into implementation, into programs, so that we can, share its results and move it, and also translate it to other communities as well. So because we're at a youth conference, and also I'm particularly interested in early intervention and prevention approaches to mitigate kind of long-term substance use, or the harms related to substance use. So that's our focus today. It's about earlier intervention and also prevention models. And also at the same time, I know our conference, has a large focus on overdose, on kind of the critical care. But I think, all of us do recognize that, in our system and the healthcare approach, we can't really just focus on the extreme cases and only do crisis management, of course. So there needs to be quite a bit of effort into upstream approaches, and even in cases where there is not problematic use, but provide prevention and support there, and look into what are effective methods and what are better ways to build that, resilience in our youth. I'm also a mother of 2 young children, so I come from that lens as well. They're quite young, and I starting, to think about it in my work too, and how it's adapted for parents and for families and their struggles as they want to support young children and the youth. So that's a little bit of my background. We'll start. Okay, so why invest in drug education and prevention? I think you're all here, so you probably already are a believer that this is important, or perhaps I need to convince you. I'll try. But we really do understand that adolescence is a peak time in the developmental course of individuals. And it also is a peak time for the development of early substance use problems and also mental health issues. There is evidence to show that when there's earlier initiation of drug and alcohol use, that could lead to more negative outcomes later in life, from the very basic, perhaps, school performance or poor school performance issues to early dropout. And then this increased risk of dependency, sometimes it leads to, or it's also co-occurring with, mental health problems. It may mask some of those problems so that treatment for mental illness may be delayed. It could also be a coping mechanism for individuals to use to cope with the mental health issues. So a lot of it is tied together, and without earlier intervention and recognition, that illness can progress to more chronic issues, of course, through adulthood. So Prevention is key. I do believe that. And that education and building resilience in our youth and young adults is very harmful prior to substance use and harmful exposure to substances. And also, another key issue here is overdose awareness and risk management. And I think through this conference, we have talked a lot about overdose, and we will be talking more about that. Of course, that is at the kind of crisis point already, but early prevention can mitigate and can support and hopefully can prevent cases of overdose. Now, I'm also discussing this from a lens of understanding that youth and adolescents are at a time when they're experimenting. There's a lot of reasons for youth to use substances, and it's not about complete abstinence-based messaging that, a substance use is just not allowed, it's completely harmful, so just must not be used. And I think, we're quite aware that that kind of messaging is not effective. And the reasons for youth to use substances are various, from kind of maybe peer pressure from friends, so there's a social pressure there, to a time of experimentation, and that is really the time for adolescence, and it's meant to be, a time for experimentation. It could be a way to handle their stress, to fit in, to push back sometimes, to boundaries. And then other issues like just curiosity or boredom or dealing with loneliness, or earlier, like I was saying, coping mechanisms for anxiety or early symptoms of depression. And then just to perhaps have fun and feel that it's, enjoyable to take some risks as well. So there's various reasons for youth and adolescents to experiment and to try substances, and it's not in, of course, all cases where the individuals would always develop problematic substance use, but there is a subset. And so I think what's critical, and as I will discuss more through the presentation, is during this period of experimentation, what can be done to provide more support, a structure, and to also help support individuals into building more resilience so that experimentation can occur without problematic use happening, or without it masking perhaps mental illness or other needs for help that we're missing. Now, for overdose and overdose prevention, I think it's often if we do look at studies and numbers, so sometimes questions come up, it's okay, how many youth, how many high school students, for example, in that age group are suffering from an overdose? So we are certainly in a time of crisis here, and in BC, we have escalating numbers of overdose cases. It's continuing to rise. We have, different presentations today talking about maybe the reasons for that. Now, how about in this age group we're talking about, where I'm wanting to focus on is like the high school age, so 18 and younger. So really the children, adolescent, and youth. If we take the whole spectrum of individuals who are suffering from overdose. So in this graph, it's a little busy, but it kind of plots it across the years from 2013 to 2023. And this data is valid, or it's recent up to January 31st, 2023, and it's from the BC Coroner Services. The 0 to 18 age group that you see in the darkest blue color, which is very small relative to all the other age groups. So sometimes it's missed. People think, well, it's very small subset, maybe it's not really of a concern. Of course, we see the larger, like, for example, in 2023, that's just for January, 27% would be in the 30 to 39 range. Then we have the 40 to 49 is light green, and then we have 50, 59, and then up at 60 plus in the red. And then 19 to 29, which we're recognizing now as still like a transitional youth period, kind of transitioning into adulthood, and that's taking up 15%. So they're just recently graduated from high school in the 19 age range. So still reachable by kind of universal prevention school-based programs. But if we do take that really small fraction, it looks like in the bottom of the 0 to 18, just look at that group by itself. And then we look at them across the last 10 years. So 2012 through to 2023. Now of course, you notice that statistics has dropped off between 2022 and 2023, but that's only because this is data up to the end of January. So that 2023 only has 1 month of toxicity deaths in this age group. So I think we need to kind of just ignore that drop off because it's early in the year. But if we look at the trend going up from 2019 to 2022, it's quite concerning, that dramatic rise in those who have suffered from a drug toxicity death in this age group. And it really, from 0 to 18, this like preventable cause of death, to me is really shocking and disturbing. And if this just continues to rise, I think, we are missing something. We really need to take a look at the entire lifespan and know that earlier intervention at this point can really save lives. And if we look at specific numbers now, so in the 0 to 18 group across the years, we have really a dramatic increase during the COVID years, right? 2020, we had 18 deaths in this age range. Then the next year, we climb up to 31 in 2021. And then the next year up to 34. So I think that this dramatic rise is missed, if we only look at the full range and say, okay, well, the larger percentages are in these other age groups. But I think anyone losing, a child in this age range to really a preventable death, every life counts, right? So I think that we need to pay a little more attention to that, and also be aware that these numbers are escalating. Probably a lot of underlying reasons why. Like I said, it does coincide with COVID in the last couple of years, and we know that has affected mental health and substance use in many ways. But I think as a group, as society, as researchers, educators, we need to take note of this. And now this next slide I put in because if we want to dig into the trajectory of substance use and the harms related to it, and also the differences between individuals. So some people can perhaps be using substances experimentally and will not develop problematic use versus others will. There really is an interplay of many, many different factors. And after extensive research, you can't find direct, causal relationships, but many correlations. And few main deciding factors or kind of harms that could occur is early life adversity. And that is one critical factor that we've seen that could lead to substance use and later life comorbidity with mental illness. And the early life adversity can have different types of adversity or trauma that has occurred in a young person's life, when that occurs and how chronic that trauma is, leading to chronic stress, that plays a large role. And then in this adolescent period, there are huge developmental changes happening in the brain. And we know that the prefrontal cortex is still under development and really isn't fully developed until about age 25. I mean, that's an estimate, we don't really know, but that's well into adulthood. So the earlier years of adolescence, when the frontal cortex isn't fully developed, all the functioning that it's responsible for, the executive functioning, decision-making skills, learning from past experiences, weighing options, all those skills are still forming. And so that's another reason why it makes the brain particularly vulnerable at the developmental stage. And so if we keep that in mind and recognize it, and perhaps delay substance use or experimentation, can delay it to any later age, the later the better, because then at least the brain is, the formation is progressing, and the executive functioning, all that is a little bit more well-formed in an individual. Also, at this point in time of the brain's development, there is a lower impulse control, and the ability to kind of think through actions, so not act on things as quickly, thought processing. All those are kind of intentional skills and processes that are not quite as well formed in this age group as well. And another point that is that substances can really have a powerful effect on the developing brain. It can really activate the developing brain. The reward system, the pleasure centers of the brain are on high alert. And also, as I listed there, a lot of the reward systems, so like the dopamine centers of the brain, they have a very powerfully influenced by certain substances. One other point to note about this developmental period is the process of pruning. So that's when neuronal connections, kind of ones that are not strengthened, are also being eliminated, and ones that have better connections formed, having more practice or development, those are strengthened, and those pathways are being influenced more. And so these different pathways can get reinforced by substances being on board. And one more note there is the stress circuit too. So that can be affected by early life trauma and early life experiences. The ability to handle stress and manage stress. There's something called an HPA axis, and that is affected by early life experiences, kind of the threshold for which stress causes more physiological responses and effects. Then in addition to this, there are individual differences as well, genetic predisposition, and then social and environmental factors, all that play a role. Now, I think one hopeful piece is that despite early life adversity, despite the fact that the brain is developing and still changing and is very susceptible to early life trauma, is the idea that resilience can really help and support the brain's development. So social support and strong connection to caregivers, that can really help the brain develop resilience, or the person develop resilience to any early life trauma experiences, and also substance exposure. So prevention does need to occur early. And so the idea that children and adolescents spend a lot of their waking hours in school makes that environment really an ideal place to implement information support programs, and to help build this resilience and develop these life skills, which I think there has been a great progression towards that in schools, to move beyond just providing like an academic structure and academic education, but really supporting the life skills and the management, stress management, and incorporating that into the curriculum. So there needs to be really tailored messaging that is specific to each developmental level. That has been shown to be quite important when they looked at broad-based universal prevention programs, is if it's not tailored, if it's not really made specifically for that age group, which ranges significantly in their needs. So in the high school age range of 8 to 12, so from 12-year-olds to 18, 19-year-olds, they are going through significant developmental changes. The messaging needs to be quite tailored and targeted. I will pause here for a minute. I have a short video clip to share, but are there any questions so far from the audience, or did anyone want to share any of their experiences or some thoughts? Doesn't look like it. Okay, I will. I have this great kind of little video that's made by the Alberta Family Wellness Initiative. And they have put together some great kind of core storyboards and concepts. So I wanted to share it with you and kind of just to break up the time we have as well.
Science tells us that the experiences we have in the first years of our lives actually affect the physical architecture of the developing brain. This means that brains aren't just born, they're also built over time based on our experiences. Just as a house needs a sturdy foundation to support the walls and roof, a brain needs a good base to support all future development. Positive interactions between young children and their caregivers literally build the architecture of the developing brain. Building a sturdy foundation in the earliest years provides a good base for a lifetime of good mental function and better overall health. So just how is a solid brain foundation built and maintained in a developing child? One way is through what brain experts call serve and return interactions. Imagine a tennis match between a caregiver and a child, but instead of hitting a ball back and forth across a net, various forms of communication pass between the two, from eye contact to touch, from singing to simple games like peekaboo. These interactions, repeated throughout a young person's developing years, are the bricks that build a healthy foundation for all future development. But another kind of childhood experience shapes brain development too, and that's stress. Good kinds of stress, like meeting new people or studying for a test, are healthy for development because they prepare kids to cope with future challenges. Another kind of stress, called toxic stress, is bad for brain development. If a child is exposed to serious ongoing hardships like abuse and neglect, and he has no other caregiver in his life to provide support, the basic structures of his developing brain may be damaged. Without a sturdy foundation to properly support future development, he is at risk for a lifetime of health problems, development issues, even addiction. It's possible to fix some of the damage of toxic stress later on, but it's easier, more effective, and less expensive to build solid brain architecture in the first place. One of the things that sturdy brain architecture supports is the development of basic emotional and social skills, an important group of skills which scientists call executive function and self-regulation can be thought of like air traffic control in the child's mental airspace. Think of a young child's brain as the control tower at a busy airport. All those planes landing and taking off and all of the support systems on the ground simultaneously demand the controller's attention to avoid a crash. It's the same with a young child learning to pay attention, plan ahead and remember, and follow lots of rules. Like all of us, kids have to react to things happening in the world around them, while also dealing with worries, temptations, and obligations on their minds. As these demands for attention pile up, air traffic control helps a child regulate the flow of information, prioritize tasks, and above all, find ways to manage stress and avoid mental collisions along the way. Having this ability is a necessity for positive and level mental health. Developing effective air traffic control, overcoming toxic stress, and building solid brain architecture are things kids can't do on their own. And since strong societies are made up of healthy, contributing individuals, it's up to us as a community to make sure all young people have the kinds of nurturing experiences they need for positive development. To build better futures, we need to build better brains.
Okay, so that was the end of the video. I do see there's a question. So Rachel, I'll just read that because I saw it pop up. But thank you for asking. How can we reverse the neuronal pruning and building those harmful patterns? Yeah, that's great. So, wanting to focus on recognizing that this is happening is important, but then also not, thinking, okay, then it's only one way. Of course, it's not true at all. So rather than, so much of it, not as of a reversing kind of idea, but it is rebuilding. So it's building new pathways, It's strengthening new approaches. And, a lot of things like habits or formations or thought processes, those are developed over time. So, for example, like a negative thought process, on a cognitive level through CBT, you can work through that. You can build a new thought process and strengthen kind of new approaches and new ways of interpreting situations. So certainly there's a lot of ways that we could rebuild new patterns of thinking, new connections. And then if you're doing, a little bit more, extreme kind of substances that have affected the brain and have developed some other adaptations. I mean, the brain is very plastic. So neuroplasticity has been shown again and again that through when substances are, no longer on board, there is, definitely a period of, for example, withdrawal where the brain has adapted its function, but over time it could mediate and that could change and the brain can repair, that it is very plastic. I hope that answered your question. Okay, so go back to this next slide here. All right, so we've talked about kind of how important it is to focus on these early years, recognizing that toxic stress, could, affect the developing brain, but then building resilience and different skills can then, strengthen an individual. So, and also, school-based prevention programs, like I was saying, are really a good platform and a venue to reach, students and children in this age group. We recognize that now in youth, there's really a changing landscape for what they're exposed to. And it has, been dramatic, I think, some of the changes that have happened. So, for example, the popularity of vaping has increased quite a bit in the last few years. Cannabis is legalized, in different regions or in different countries. Of course, they see, different effects of that. Binge drinking is still a problem amongst high school students. And then overlay on top of that, we have the opioid overdose crisis. And then we have, COVID in the last few years too. So, it's, all these different things are happening in a young person's life. So, what is our best approach? If we go back to some of the DARE programs, which I'm familiar with when I went through school, the messaging at that point was like scare tactics. It was a lot of, just posters about saying no to drugs. It's bad. We have to resist it. There's leads to delinquent behavior. So it's very black and white and very abstinence-based. So that was the messaging for quite some time. And then that moved into a lot of posters, which I think they called it like scare tactics, making youth feel that they would be harmed right away if they were using substances. And so this was a lot of posters put up through schools. They may have law enforcement come in to give talks, I think, in schools. And that has been their approach for quite some time. Unfortunately, there's a lot of data showing that this doesn't work, from asking students to, what have you learned from these seminars, to even looking at how it affects substance use behavior, and it doesn't change. So then there's been quite a bit of work looking at school-based drug prevention programs that are evidence-based, that are developmentally appropriate. And doing these reviews, they find if programs are developed with the youth in mind, so often with co-creation, with feedback from adolescents and from students, that really supports the program being well received and well liked. Another part is that the substance use messaging needs to be part of a comprehensive health education curriculum. So kind of taking a more holistic view is not just focusing on specific substances or not using specific substances, but is taking the student or the individual as a whole and supporting them in all the different ways. It's messaging, it's information about a lot of different things, such as managing stress, such as sleep, diet, and other kind of health-related issues. One key point that has been brought up is the use of peer leaders. So recognizing that the social influence is really important for students. So having peer as champions, or having peers involved in supporting or mentoring, other students, that can play a key role in making a solution more well received and also successful. And then another key piece is interactive teaching methods. So, different from, for example, how we're doing here, just presentation based, just one person, giving information, but really interactive. So having the students involved, having activities, and then adopting social influence and a very comprehensive approach. So these were all different key factors that have been found to be effective in school-based prevention programs. So I had the pleasure of working and collaborating with Vancouver School Board, and being just finding out more about an approach that they have used. And so, oh, I see. Sorry, Aresh.
Since we have someone from the support and connecting youth as well, that they have questions. First, there's a question about the benzodiazepine crisis, which has been followed the opioid crisis. Their question is, are there studies linked to the use of benzodiazepines in youth, and are there similar numerological outcomes?
Yeah, so in terms of the data on the number of youth who are using benzos, that we don't have any clear numbers on that, recent numbers. So the last survey done, I think, would be data from 2018. So from the Mercury Society, they do every 3 years a survey of students, and they ask them, mental health related questions, as well as there's a good focus on substance use. And so the last set of data that we have is from 2018. I believe the 2023, so I guess it's every 5 years. So the 2023 data I think is still not fully collected or out yet. But from 2018, that was prior to the crisis having escalated, and 2018 is, prior to COVID. So, we'll have to wait and see what the numbers are like. So I don't know what, right now the rates of use of benzodiazepines are, unfortunately.
Thank you. And there's another question regarding, is there support research for prevention and health promotion for including caregivers in this process, and arming them with resources, information, and support in how to respond when they see these behaviors?
Yes, absolutely. So Sassy, this is one example of a program that does take an integrative approach. So it's not just targeting the students and the adolescents themselves, but it is providing information and support to family members to help build that. So like I said, the pieces need to be in place. So not support the individual, then you need to support the family, and then the greater community. So yes, there's evidence to show that when families are given more resources, that can really help the outcomes in the youth.
Thank you. Yeah.
And then I will also, after this, move on to some other examples that have been have some evidence to show that the supporting families are helpful. So yeah, that would be in the next couple of slides. Okay. That's the answer.
Yeah.
All right.
Okay. Questions are done. Thank you.
Yeah. Okay. Okay. Thank you. Yeah. I see. I think it was some links that was there. Yeah. I think maybe there needs to be some updates. So thank you to the person who shared an updated link there. And I can share. I'll make these slides available through Whova on the platform if anyone wants to go back to look at it, and then also include some links to the solutions that I'll be sharing about. Yes, so SASSY, the Supporting Connecting Youth, so they take an approach where they're including the parents in the engagement. They also have the youth engaged. There's curriculum, there's teacher training, and then there's a focus intervention for youth who are at risk. So a more intensive program and a workshop that then can support youth who are already perhaps using substances or have some problematic substance use at an earlier stage. So this is quite a comprehensive program, and I think they've done really well. And for, this is a collaboration between the Vancouver School Board and Vancouver Coastal Health. And I mean, if someone in the audience knows of whether this has been expanded or not, from what I understand is, unfortunately, other school districts have not had the same program, but maybe, nope, someone posted, so Surrey schools, you have a wraparound care too. So that's great, yes. I think the last time I was in a presentation with SASSY is there has been others in the audience who talked about wanting to implement something like this in their school district. And I think that the ability to collaborate and share this information resources is wonderful. And I know that they have, a lot of curriculum already established and their model of approach. So I would think that, those who are interested and of course needing to find the funding would be able to implement, a setup like theirs. Another program that has been in development and has been more of a provincial-wide, I guess, initiative is this ABCs of youth substance use. And this initiative has been built to support approaches that are evidence-based to reduce the substance-related harms. And the ABC stands for autonomy, belonging, and competencies. And that's building that in the individual and also in their supportive environment, so in the families and in the caregivers as well. And the ABCs of youth substance use, it's funded by the BC Ministry of Health. So that's why I think this one is more provincial wide and kind of reaches, beyond the VSB borders. And they're a collaboration between a few different groups as well. So here I've just listed their approach. The text, might be a little bit small to see on the slide, but like I said, I'm going to have these posted later. But they have looked at the evidence, has looked at different programs that are effective and pulled out the key pieces, which is, moving, like I said, beyond focusing on just the substance use, but building connections, strong connections in the individuals, and then giving this information to caregivers. So someone in the audience had asked earlier about, resources for parents and caregivers. So yes, the ABCs of substance use does have a lot of information for families as well, in terms of how to talk to youth about substance use, how to recognize, when they need help, how to open up the conversation, how to be a positive role model for them, how to, recognize that substance use would occur, experimentation will occur, but how to be safe in the behavior, and emphasizing that too, and having those conversations with youth. So this is also adapted now. So that was, BC. Now across Canada, Health Canada has also, now recognized the importance of a broad-based prevention programs across educational programs and implementing them in schools. So they have developed some frameworks and pillars of delivering this messaging. Again, moving beyond just focusing on substances, but taking a comprehensive approach to supporting, mental health, well-being, and resilience. And the social emotional learning is another key piece. And so they're developing programs along this too. But one thing I want to point out is, a lot of these effective interventions and programs are either face-to-face, in group settings, sometimes, in a classroom setting, a lot of content and a material. I think that, there's also a lot of other ways we could reach youth. And I think if we look outside like our Canadian borders, we have international colleagues who have kind of moved forward on this agenda a little further and taken like a more virtual approach. So the e-health approach, and developing solutions that are, interactive, can engage youth, and that are also very accessible. And so I just want to transition here to bringing up just a couple of examples from Australia and also from New Zealand. So we heard this morning from one of our Australian colleagues, from Ian Hickey, and in their Brain and Mind Center, they have a specific framework there, but they also really utilize e-health and e-mental health approaches. Another example that's out of Australia is something called climate schools, which now they're called Our Futures. And they, this took, of course, a lot of funding to develop as well. It's not easy to develop a very interactive platform that's engaging for students, but they put together something that is driven by like a graphic novel approach or series. And in the attempts of helping students learn about their social, emotional well-being through storyboards, through kind of character development that they can engage in and understand. So the climate schools and Our Futures, what they have is a set of characters, and they go through, their daily interactions at school with their friends. And as an individual, you can kind of when youth use this program, it's interactive, so they can see what are some of the decisions that the students make, and what are some of the choices, and then what are some of the behavioral outcomes. So it kind of leads them through a more engaging storyline, and they kind of learn about some CBT methods and ways to deal with some anxiety or depression, but through storytelling. So I thought, this is quite an innovative approach. When they have done several RCTs with this study, and other than the students learning some basic information, there was just I guess an embracing the innovation, the fact that the program seemed to be tailored and built for them, and so that is really appreciated. And a little bit different from our standard, I guess, textbook workshops type of delivery. And this is also a program they can do at home, and it's computer-based. Just a couple of screenshots on how it looks. They have different modules that are targeting different substances. And so this is developed by our colleague, Dr. Marie Thiessen, over the Matilda Center in the University of Sydney. So like I said, they ran several RCTs looking at uptake, participation, and then the effectiveness of how it changes behavior. And the, I think, key outcome that we had talked about earlier that we really want to focus on is delaying the onset of substance use. So kind of just delaying it by a year or two, would make a significant impact. Another program is called Sparks, and this was developed in New Zealand by someone named Dr. Sally Mary. And this took, I think 10 years of development and a lot of money, but they developed a game. And this Sparks is based on kind of an adventure, like a quest game, and it's to support youth in their mental health struggles. It took, quite a bit of development, and they were the first, I think, to build a mental health related game. And they use CBT ideology behind it. So it's teaching CBT skills, but through like complete gamification. So, beyond the simple games that we would have now on our apps, like, rewards or points and things, to an actual, immersive experience where an individual, struggles from mental illness or struggles from symptoms of it, and they have to can develop skills to then manage it in this other world. So I thought that would be interesting to share as a solution. So in Canada, we have also because of, I think, a COVID leading to a difficulty in some face-to-face engagement opportunities, is develop virtual solutions. So we have Wellness Together Canada. This is another solution. We have the Kids Help Phone, which originally was, a phone line based, but now is online and has kind of interactive apps and ways for you to connect, or for youth to connect with someone live, one-on-one, through either chat, messaging, or through video conferencing. So just to make it more accessible, kind of to use the technology we have at hand. I see some chats popping up, people mentioning, yes, like Foundry. Yes, Foundry is another great organization that has a lot of support for youth in substance use and mental health, and they have Foundry online too. So a lot of connections and apps and resources that you can find through their website. Next, so before I go on, to see someone mentioned, yes, so Preventure, that's another program. It's a really targeted for youth who are at risk. So Preventure has a lot of good evidence supporting that it's effective. It takes a not so much broad-based universal prevention, but it's, like I said, it's more targeted. So it's identifying youth and students who might have more high-risk behaviors, who may be dealing with impulse control issues. And so it's a targeted prevention approach. And I think currently they are doing an RCT in BC, and they have a couple of publications out as well demonstrating their effectiveness. And I think, yes, the universal screening. Yeah, so they screen all students, and then I think they select those who are more at risk for the to actually go through the material. Okay, so in terms of prevention perhaps being stigmatizing, yeah, so I don't know. I guess that may come from a place of, because of the universal screening and then identifying students who are at risk, that is stigmatizing, because then I guess, they are selected to, or, advised to then do the program. So they are kind of, yeah, that could come with it, some stigma. Maybe that's what you mean. I'm not quite aware of the discussions that are ongoing about it being stigmatizing. I guess there has to be, any program that is targeted intervention or early prevention, unfortunately does then select, subset of the population. So I can see that happening. I guess there just needs to be a way to support all students all around. I think universal-based programs, I didn't mention that before, but one key outcome of that also is to decrease stigma. So I think broad-based resilience building programs that are implemented, in the entire school for all students, more discussions, more conversations about that in general would reduce stigma. So then, hopefully once, some students who do need more support or, more assistance, go through a more intensive program, that the information that was given broadly to all, hopefully would decrease, the stigma among students in general. But yeah, I think stigma against substance use and mental health is a huge piece that, it has been ongoing. Okay, so next I have a couple of slides left to share about, and this is a solution that I wanted to share with you as well, called Minder. And this is a project that I've been a part of as well. So it's funded by Health Canada, and the PI is Dr. Daniel Vigo from UBC in the Department of Psychiatry. And Minder was developed for university students. So it's an app that is broadly for all students. It's not specific to supporting anyone with mental illness, but it's supporting and building resilience and coping skills, stress management strategies for all students. There is also a substance use piece on it as well. And so right now, Minder is in an RCT phase, so we're still collecting evidence. The aim is to have 1,500 UBC students enrolling in this study, and to look at its outcomes and how effective it is at managing symptoms of stress, of depression and anxiety, and also in managing substance use as well. So at the same time, I've been involved in adapting Minder to the high school student population. So we're calling the high school solution Younger Minds at the moment. So high school students actually are, I think, much more extensive, and the range of their needs is much wider than in university students, because I think, once students do get to university, they have developed a certain set of coping skills. They've at least, they've graduated and they are in higher education. There's still a lot of need there. But when we've gone into high schools now and had conversations with students there, we see there's, a wide range of needs. And so a solution that can support high school students need to have various components. And I think that's what we're learning now, is that we need to speak to those along a whole continuum of needs. And there are different domains and topics that have come up in this adaptation, such as building some pieces around bullying and body image. That was a little bit different when it was created for university students. So the process of creating the solution really had to come from the user group. So in Minder, university students were part of a student advisory group, and there were multiple focus groups, a lot of co-creation and iterative processes where they were able to give input on what they felt the solution needed to be. So as you can tell from these images and cartoons, there really is a change in the way that things are presented and portrayed. And it really needs to be adapted to the user group. So we've had very positive feedback from students on this user interface and on how things are presented. They go through different islands that they want to manage. So there's wellness island. If they're feeling sadness or anxiety or loneliness, then they can explore issues around that. And then there's a chat bot that actually walks them through using CBT approaches to support them. So what we'd like to do now is to adapt this to high school students and, bring in the other concerns that they have. We'll be adding, different islands, changing some of this around, but still keeping the framework. And we've so far had some pretty good responses as well from high school students. Okay. Another solution that is, I think, quite innovative and is taking kind of using the technology that we have at hand to reach people is the risk assessment and management platform. There was a presentation this morning about this platform, so I won't be able to go into in detail. It's quite a comprehensive solution, but just to summarize, it's a risk assessment and management, and it's a risk assessment for overdose. So it's particularly for crisis management and for overdose management. But it really emphasizes the possibility of reaching people through apps, through web-based solutions to target some very critical areas across the whole spectrum of needs. Okay, so we are at only 5 minutes left. I have one last video that I was hoping to share, but it is 7 minutes long. So I'm wondering if maybe I should just post the link so those who are interested in watching it can go back and watch it, and then I can address a couple of the questions that are still remaining on the chat. What do you think, Aresh?
I think that's a good idea, yeah.
Okay.
Yeah. Do you know, sorry, I had closed my chat window, so I don't see the newest ones that pop up. The chat?
Yes.
So that, going to find it.
Okay, here, I see the new messages now. Great, thank you. So I think we're here. How can we support our youth who do not have a healthy adult at home? Consistent adults in our school system. And healthcare system is challenging due to turnover. Yes. Yeah, I agree. And if someone else has ideas, please feel free to chime in as well. So, if there is not a healthy adult at home, which we have seen in some discussions we've recently had when we're working on a Younger Mind Solutions, because we've been trying to explore with our youth what are their main areas of support and where would they go to for substance use information, where would they go for mental health support. And in some cases, there is not a supportive family environment for that. I think there are community-based groups, there are peer-based community groups that we could, utilize more. And the school, so the school system, like I was saying, these prevention programs, kind of more broad-based programs, can help support and train students to then also be peer supporters. So there's an opportunity for peer support in schools, community-based support, and programs that are run with nonprofits. And then it will be most likely adults who are in the child's life, as teachers and educators, who can then, provide, role model and support there as well. Yeah, so Carmen, you're suggesting like support workers, like the sassy youth workers. Yes. Yes, I agree. Yeah. Probably another key is the vulnerable youth who are no longer connected maybe to a school system because they're not attending school. I know that really marginalized youth and that younger population are very difficult to reach. So in those cases, then I think we do have to look for the nonprofit, who are then available for marginalized youth. I know Coast Mental Health has a wonderful peer-based youth program as well. And they also try to have a lot of, peer and support workers who try to connect with the vulnerable youth who are, marginalized and who are also, with unstable housing as well. And yes, intensive case management teams can connect with these youth as well. And I know at Foundry, they have a lot of very dedicated workers who try to connect with the vulnerable youth too. So yes, I do think it takes, everyone in the community to recognize that need and to reach out and to support the youth. Great. So that last video I had is also developed by the Alberta Family Ministry. It's kind of like a theatrical representation of a brain that is suffering, and I thought it was a good way to end off, but I'm glad we had more discussions instead. But if you're interested and have the time, I really invite you to go back to the Whova page. I'll post the video there for you to view.
Okay, thank you very much, Fiona. That was awesome. I think we reached to our deadline.
Yeah.
Yeah. So thank you, everyone. I say goodbye and thank you for joining us today.
Okay. Thank you.